Peripheral neuropathy is a frustrating, painful, sometimes disabling condition that affects millions of people across the world. Now, if you're one of those people, I promise you need to watch this video until the very end because it's going to help you. If there is a chance to slow down the progression of your neuropathy, to actually stop the progression, to reverse the progression, or even to completely reverse your neuropathy, the answer is contained in this video. I'm Dr. Johnson Terry, a family physician with 20 years of clinical experience. And this video is going to help you with your peripheral neuropathy. Peripheral neuropathy is so pervasive, I guarantee you, several of your friends and family members already suffer from it. So please consider sharing this video on your social media, on your Twitter, your Instagram, your Facebook, because watching this video might help someone understand the root causes of peripheral neuropathy. And with that knowledge, they can then begin to slow down the progression, to reverse it, or even to cure it. So first, let's get out of the way things that are definitely not going to help. Okay, because people spend money every day on products that are promoted to help peripheral neuropathy, and I'm going to give you the short list of stuff. You can save your money. There are wasted money. You don't need to buy them ever because they don't even address the root cause of the neuropathy. They're going to waste your money, and they're not going to fix anything that you rub on externally. So if you have peripheral neuropathy in your feet, toes, legs, and someone's selling a cream, a salve, a lotion, a balm that you rub on your skin, and this somehow is supposed to help the peripheral neuropathy, that's foolishness. That's a waste of money. That's never going to help. I've actually seen lauded doctors and experts out there say that you should decrease your salt intake, or you should decrease your saturated fat intake. Not only is there no research to back this up, but actually, it goes against the actual neurological physiology in the human body. Your nerves need salt, and they are made of fat. So these two recommendations are foolishness. Some people say, oh, taking this certain multivitamin or this certain vitamin complex is going to cure your neuropathy. Never does that work. It might help a tiny bit if you have a vitamin or mineral deficiency. But if you don't have one of those deficiencies, that's not going to help at all. You'll see nerve support formula out there that come in capsules, pills, and maybe even shakes and powders. This is another complete and utter waste of money. You don't need any of these things that I talked about above. They're not going to help your peripheral neuropathy at all. There are a few prescription medications that will help the symptoms of peripheral neuropathy, the burning, the itching, the aching, the pain, the numbness, but they in no way address the root cause. And each one of these has a long list, not of possible side effects, but of probable side effects. You're going to have side effects if you take one of these medications. They include Lyrica, Neurontin, amitriptyline, and then Tegretol. Most of these are medications for either seizure disorders or for depression or mood disorders, and so they will knock the edge off of your symptoms. But in no way will they cure, reverse, or slow down the progression of your neuropathy. Now, let's go through the list of things that are known to cause peripheral neuropathy, and I'm going to start first with the least likely. These are the 1 in 1,000 or 1 in 100 things that might be causing some of your neuropathy, or in the very rare individual might be causing the majority of the neuropathy. But these are the very rarest of causes. I'm not saying all these things are super rare. I'm just saying they're probably not what's causing your peripheral neuropathy. They include alcoholism. If you drink alcohol for too many years, amyloidosis. If you're taking chemotherapy that can lead to neuropathy. If you have toxic levels of heavy metals, that can lead to neuropathy, porphyria, dysautonomia, AB12 deficiency. Absolute, we can cause a peripheral neuropathy, idiopathic polyneuropathy. And you may know from other videos on this channel that idiopathic means we don't know what the hell's causing it. But at least they can put a diagnosis on it. Paraneoplastic syndromes. So if you have cancer in a specific location in your body, that can lead to some peripheral neuropathies. Lyme disease is a rare but known cause of peripheral neuropathies. Sarcoidosis, and then small vessel vasculitis. Any of these things can lead to peripheral neuropathy. Now let's talk about the most common causes. And these are the ones you want to focus on, because probably 90% of peripheral neuropathy in the world is caused by one of these things. They really boil down to two different things, which I'll get into after I name this list. Diabetes is absolutely a huge cause of neuropathy and hyperglycemia. And then prediabetes, years before you develop type 2 diabetes. When you're in the very earliest stages of prediabetes, you can be developing neuropathy. In fact, that's how many people are diagnosed with type 2 diabetes. They go to the doctor and say, "Doc, my feet are burning, and I don't know why." So that can absolutely cause it. Chronic hyperinsulinemia, which is a part of prediabetes and also a part of the next one, which is metabolic syndrome. Chronic inappropriate inflammation, just chronic inflammation, caused by either your diet or something else entering your system, leads to chronic inappropriate inflammation. That inflammation can attack your small nerve endings in your feet, toes, legs, hands, arms, and other parts of your body. Autoimmune conditions. If your immune system is strong but confused about where the boundary between you and not you begins, then your immune system can actually start to attack your nerve endings. The hyperglycemia that comes from type 1 diabetes, type 2, these prediabetes, and hyperinsulinemia that comes years before even prediabetes starts. The hyperglycemia is the problem because this chronically high blood sugar or multiple spikes of high blood sugar every time you eat an inappropriate meal for you actually glycates the proteins on the myelin sheath of the little nerves out in your periphery. The longer a nerve is, the more likely it is to be affected. When you glycated your myelin sheath, your immune system comes along, your macrophages, and they start to say, "Hey, this doesn't look right. There shouldn't be a glycated protein right here." So they start to phagocytize or engulf it and actually destroy your nerve ending. So you've got the perfect storm of hyperglycemia, leading to glycation and then your immune system, which is confused because there's a weird glycation on a protein that shouldn't be there, actually starts to attack that. Again, with chronic inappropriate inflammation. That's the second big arm of this. You actually will start to have inflammation around the arteries because your immune system is confused by all this. Inflammation everywhere all the time, every day, so it starts to attack parts of you that it shouldn't. In some people, this manifests as Hashimoto's thyroiditis, and in some people, this manifests as lupus or Sjogren's or all the other autoimmune conditions. Type 1 diabetes with the beta cells in the pancreas. In some people, your immune system starts to attack your small nerves out in the periphery of your body in your legs and arms, and that destroys the cells. You may have heard of phantom limb pain in the past if someone gets an arm or leg cut off in a trauma or cut off because they had severe, uncontrolled diabetes. They can actually have phantom pain out in that foot that's no longer there. We know from this example that nerve pain can often be from the absence of a signal because your nerves in your smallest toe to your biggest toe to your leg, they're always communicating back and forth with your brain, basically sending the OK signal back and forth. If your brain is not getting an OK signal from your toe, because either hyperglycemia or chronic inappropriate inflammation in the immune response has destroyed that nerve at some point, your body manifests that as pain. Even though there's technically nothing wrong with an amputated foot, the foot can't be giving you pain. It no longer exists. You're still getting a pain signal. All this works together to lead to peripheral neuropathy. Now let's talk about the testing that you need. 90% of the testing you need is right at the top of this list. And then I'll talk about the less common and more esoteric causes. Right off the bat, you need a hemoglobin A1C, you need an AC peptide. You need both of these checked immediately to see what your glycemic situation is, to see where you are with prediabetes, hyperglycemia, or type 2 diabetes. Then you can start to reverse that. You need a complete metabolic panel, a urinalysis, a CBC with differential acid rate, and a CRP. You need a vitamin B12 level check because that's one of the things that can lead to peripheral neuropathy or worsening of it caused by other issues. You need a complete thyroid panel. I've talked about all the testing that this entails in other videos on this channel. Just search Dr. Terry Thyroid on YouTube. You also need a GGT, a hepatitis panel as well. Sometimes people with chronic hepatitis that's never been diagnosed are only discovered when they go to the doctor complaining of burning in their feet, toes, and legs. You need a VDRL test, which is a test for syphilis. Syphilis is the great imitator and can present with virtually any symptom, peripheral neuropathy being one of them. You need heavy metal testing done. There are usually 2 panels, so ask your healthcare provider for both to catch any toxicity. Outside of the lab, you can consider electrodiagnostic studies, nerve biopsies, and skin biopsies looking at small nerve fibers. You probably won't make it all the way down the list. You'll likely find the reason for your peripheral neuropathy high up on this list. If your doctor can't find the cause, then you may continue down the list until all tests are completed. So, after all that, what actually works? What actually helps peripheral neuropathy? There are multiple studies showing this. I've included links to all the research I used in the show notes. Don't blindly believe me or anyone else. Check it out yourself. Here are the things that absolutely help the most. I'll start with the least likely, and then move to the things that help 80 to 90% of people with peripheral neuropathy, making sure that either in your diet or in a supplement, you're getting an excellent source of all the B. Vitamins is absolutely vital for proper nerve function. Ensuring enough magnesium and potassium, either in your diet or a supplement or both, is also vital. Getting enough vitamin D is important. And if you supplement, use vitamin D3, not D2. You also need plenty of omega-3 fatty acids, preferably from diet, but a supplement capsule is fine if needed. I have videos on this channel about good dietary sources of these nutrients because I'd much rather you eat real food than rely solely on supplements. Now, the two things that absolutely slow down, reverse, or even completely cure peripheral neuropathy in the majority of people. There will be exceptions if you have one of the rare causes. I mentioned earlier, 80 to 90% of people have hyperglycemia, chronic inappropriate inflammation, and a confused immune system, which are the major causes of most peripheral neuropathy pain. Diet is critical. You need to transform your diet from whatever you're eating now to a very low-carbohydrate diet. Remove all sugar, both added and natural, because sugar spikes blood glucose. Eliminate grains, wheat, rice, oats, corn, and others, because they break down into sugar and spike blood sugar. A low-carb diet, keto, or carnivore diet will work. This is the single most important change to lessen symptoms. Fasting is also essential if you have moderate to severe symptoms. You need to ramp up daily fasting beyond the typical 8 hours while sleeping. Aim for 14 to 20 hours per day. The longer you fast consistently, the quicker you'll notice improvement. Nerves regrow very slowly, so even with low-carb, keto, or carnivore diets, it will take weeks or months for nerve endings to regrow and reconnect. Don't expect overnight results. Nerve physiology is slow. If you suffer from severe peripheral neuropathy, even gradual improvement is worth the wait. Some patients have been driven to suicide due to severe, disabling neuropathy, which highlights the importance of persistence. I try to post at least 3 new videos every week. So click the subscribe button and the bell icon to be notified first. This is Dr. Johnson Terry. I'll see you next time.